I was 18 when I was raped. I tried to put it behind me to get over it, but the truth is, I can't. I feel nervous and jumpy. Sometimes I wake up in the night and I think he's there, in my room.
I knew something was wrong with me. I just didn't know what. And I didn't know what to do about it.
He used to beat me up, especially when he'd been drinking. We've been divorced for 2 years now, but I still don't feel safe.
I can't focus on things at work. At home, I just don't care. Since it happened, nothing makes me happy. Nothing makes me sad. I just want to be alone.
I don't like to go out. See, I'm afraid of what might happen. I'm afraid I'll lose it. I'm not the person I used to be. I'm afraid I'll never be the same.
Post-traumatic stress disorder, PTSD, is a complex condition that develops in response to a terrifying event or series of events. A violent physical attack, a serious traffic accident, life-threatening illness or natural disaster. Trauma affects people in different ways. For most, the pain fades over time, but after months or years, some people still can't move on.
About 70% of the population will, at some time in their lives, have a traumatic event happen to them. And of those 70% of the general population, about 20% will go on to develop post-traumatic stress disorder.
The condition affects men and women of all ages, but women are more likely to develop PTSD.
In fact, women are twice as likely as men to get post-traumatic stress disorder. It's a function primarily of the traumatic circumstances that women are exposed to in our culture. Women who are sexually assaulted, women who are victims of domestic violence, those are women who are at risk for developing post-traumatic stress disorder.
Also at increased risk, individuals who work or live in dangerous settings, police and firemen, paramedics and other healthcare professionals, veterans or refugees from countries at war, and people who survive the sudden death of a loved one. Whatever the trauma, experts say it can cause changes in brain chemistry, and those changes might make some people feel edgy or angry. They find it hard to relax and may constantly scan their surroundings for signs of danger.
Having difficulty concentrating, having a startle response where people will react to noises and become frightened by them. Inability to sleep is a very big problem that people with PTSD have.
So are nightmares and intrusive thoughts. People with PTSD can't escape their memories.
When you try to push a thought very much out of your mind, it comes back with more strength. So if I ask you not to think about a pink elephant, to really, that it's very dangerous to think about a pink elephant, you're going to find yourself thinking about pink elephants.
To block out frightening feelings, victims of PTSD may stay home, abuse drugs and alcohol.
Avoiding anything that might remind the person of the trauma. They numb out emotionally in an effort to keep feelings at bay. Feelings tend to bring up reminders of the trauma.
People who have PTSD develop complications. They get depressed, they get suicidal, they may drink excessively. They may be very difficult to get along with, so their relationships start to disintegrate. They may have a lot of physical complaints, particularly tiredness, aches and pains, irritable bowel syndrome, so-called, chronic pain, and those are the things that drive them to the doctor. They don't go to the doctor saying, I had a terrible event 15 years ago and I keep thinking about it.
Some people find PTSD makes it impossible to study or work. That was the case for 29-year-old Tracy Howard. She was abused as a child.
PTSD isn't always so obvious. I don't walk around shaking and, I'm not seemingly abnormal, but I really have a lot of problems. It's my thinking, that's the problem.
Rudy Dent has been fine on the job as a New York City fireman and former cop, but PTSD took a toll on his family life.
I realized I was totally neglecting my son and my family. Had I not had such an understanding wife, I wouldn't have a wife.
He would get very depressed, and there were many nights when he wouldn't sleep. He would be up just about all night, and I just didn't know what to do.
Rudy didn't know he had PTSD until he got an email from an old friend who was diagnosed with post-traumatic stress disorder after suffering the same symptoms.
I felt, well, fine. There's a name for it. Now maybe there's a cure for it. At least there's a positive, constructive way in which to deal with it. And actually I was relieved.
Recovery often begins when people with PTSD talk to friends or relatives, sharing their memories and emotions.
The most important thing that we should do is allow the person to talk about it, to cry, to reminisce, to get all the feelings out. And if they need to talk about it over and over and over again, let them do it.
Family and friends are very important and often make the difference between doing well and not doing well. Support is probably one of the most important ingredients in getting better.
If symptoms don't improve, it's important to see a mental health professional who can provide therapy and medication.
People that have been exposed to a trauma that has left them with PTSD, something's been broken. You can't measure it on an x-ray, you can't see it on a blood test, but something has been broken and it needs to be fixed.
If you have trouble sleeping, if you have trouble eating, if you can't concentrate because of intrusive thoughts about the event, or if you find yourself not able to put recurring scenes of that event out of your head, you need to see someone for evaluation and get some help in deciding whether or not this is PTSD.
He was asking me questions and stuff.
At first, patients may find it difficult to talk about their trauma, but with time, it gets easier and they start to feel better.
What you want to be able to do is realize that the only thing you have to fear is the fear that you experience when you talk about the memory. So the purpose of going to therapy is to keep telling that story over and over again until one day that story doesn't have the power that the victimizer had in creating the fear response, and that will make you better.
I don't think people can be the same. I think they can be better, or they can be worse. I mean, they can suffer from symptoms, or they can become very courageous.
Many people who are appropriately diagnosed and treated can turn it around and come out after treatment feeling much, much better about themselves and their relationships and lead very productive lives.
Tracy Howard now works with mental health care professionals, helping them to understand PTSD from the patient's perspective and to provide more effective treatment.
They should seek help because it's not unusual to have PTSD, and it's not a character flaw to have been abused, and it's not that uncommon.
Rudy Dent has more positive energy for his family, and he urges others with PTSD to get help.
They need to know they can't manage it alone. They need to know that people are really out there that really care, that are really professional, and they need to check it out.
If you or a loved one may be suffering from post-traumatic stress disorder, call the PTSD Alliance at 1-877-507-PTSD for more information. Post-traumatic stress disorder is treatable, and there is hope for recovery.